Good afternoon, everyone. Thank you so much for joining us for this week's Post-Executive Council media briefing here at the Ho Choy Charles Administrative Complex in Calder Hall. I am Davia Chambers, and I will take you through this afternoon's press conference. Presenting to the media this afternoon, we have the Deputy Chief Secretary and the Secretary of the Division of Health and Wellness, Assembly Member Dr. Faith Brebner. We have Assembly Member Trevor James, the Secretary of the Division of Strategic Planning and Development, and we have Councillor Adana Joseph Wallace. She is the Secretary of the Division of Legal Affairs. So at this time, I'd hand over to our Deputy Chief Secretary, Assembly Member Dr. Faith Brebner.
Thank you, Davia. Good afternoon to the viewing and listening public. It's an honor to sit here to have our post-executive media briefing today. It's an honor being joined by my colleagues, Secretary James and Secretary Wallace. I am here this afternoon to speak very briefly about the fact that the island remains open and welcoming for business. Coming out of the SOE that was just announced, I know that there may be concerns, particularly since this island thrives on tourism, but we just wanted to highlight to the entire public, to those who are resident, to those who are visitors from near and far, that Tobago is open, Tobago is safe, and Tobago is ready for continued business. We have been working very closely over the last year or two with our communities, our stakeholders, including our protective services, including those who do the softer side of protecting our citizens. And we have been able to boast of reduced criminal activities on the island. And because of that, we understand that there are national concerns about crime, there are national concerns about gang activities, but as the press release that was sent out of the Office of the Chief Secretary recently stated, Tobago is safe, Tobago is open, and Tobago is welcoming. So we just wanted to say that to our partners. Please continue doing business with us, continue participating in what we have to offer, sand, sea, fun, and everything else. All of our activities that are scheduled for the upcoming period, the Easter period, what happens at Buku, what happens at Mount Pleasant, what happens throughout the island is being planned and will be executed as already planned. Of course, we know that we do not have a curfew or any similar type of activity, and therefore we just wanted to say to the people, Tobago is wonderful, Tobago is beautiful, continue coming, continue participating in what we have to offer. The individuals who have been a part of this, the Chief Secretary has indicated that he will get additional information, as is usually done by the Office of the Attorney General, and we will continue to provide additional information as it is necessary. To the citizens of Tobago, to those who are resident on the island, you continue being decent, upstanding citizens, continue working with our protective services, continue speaking up, continue being your neighbor's keeper, continue being the good Tobagonians that we are, and we will continue having a safe community. So I just wanted to take a little bit of time to highlight that to the members of the public. And as we continue, as we get additional information, we will televise that to you, we will communicate that to you as is necessary.
Thank you, Assembly Member Dr. Faith Brebner, Secretary of Health and Wellness, and of course our Deputy Chief Secretary. So at this time, the Secretary of the Division of Legal Affairs, Councillor Adana Joseph Wallace, will make her presentation.
Thank you, Davia. Good afternoon, Tobago. Good afternoon to the members of the media. Good afternoon to the listening public. Thank you for being here with us this afternoon. Now, the Chief Secretary, in his wisdom, required the creation of a Division of Legal Affairs to address historic delays, inconsistencies, and capacity constraints in the Tobago House of Assembly in fulfilling its statutory statutory obligations, its policy priorities, and risk appetite pursuant to the Tobago House of Assembly Act, as well as other legal regulatory frameworks. We here at the Division of Legal Affairs, we are entirely new. We are an entirely new division, and we are currently engaged in the technical and administrative build-out of the division. Notwithstanding, we have several key areas that as our objectives. First of it being that we aim to improve legal compliance across all divisions. We aim to increase the efficiency of legal service delivery and decision-making with regard to the Tobago House of Assembly. We are also aiming to standardize processes. We are also aiming to identify and remediate legal, contractual, policy, and regulatory gaps within the Tobago House of Assembly, and establish a centralized system for legal matter processing. We are also keen on building capacity across the Tobago House of Assembly and Tobago by extension. Now, we do not yet have any telephone contact. Again, we are entirely new and we are still building out. Notwithstanding, you are free to visit us at the former Public Utilities Building on Montessori Drive, Glen Road, Tobago, or you may feel free to contact us via email at tha.legalaffairs@gov.tt. I'll say it again, tha.legalaffairs@gov.tt. Thank you.
Thank you for providing that update, Councillor Secretary Joseph Wallace. And now we'll hear from Assembly Member Trevor James. He is the Secretary of the Division of Strategic Planning and Development. Mr. James.
Good afternoon to the media, good afternoon to Tobago, good afternoon to my colleagues who prefer to sit. I feel better when I stand. So the Chief Secretary has developed this new ethos for how we deliver services to the people. For years, we have not had a division of planning and development as a separate entity. But what we have learned over the last 4 years is that there are acute problems in the THA's ability to deliver, and the Chief Secretary felt that the time was now right for us to set the foundation that would ensure that we are meeting our strategic goals of 2045. So the Division of Strategic Planning, summarized, essentially will collect data, will analyze that data, will develop strategic plans, policies and development structures for capital development, infrastructure oversight, monitoring and evaluation across the THA and across all the divisions of the THA. The question, of course, that arises is, why at this time? Why is it necessary? We have the mandate to create the environment that facilitates social, economic, capital, and development infrastructure that would help build out the economy of Tobago. As the Tobago public will know, the major employer in Tobago is the THA, and we have always been struggling to find ways to build out a private sector. And this division will set the foundation to allow for ease of business in developing a private sector in Tobago. We therefore need to come up with ways of moving forward. We have analyzed in the last 4 years the problems that Tobago face. Chief among the problems is the length of time it takes for approval, the legal framework that's necessary to allow for speedy approval of development plans and projects and all of that. And we felt that now we need to ensure that we are doing what we can to build that out. So in terms of the problems that were identified that gave rise to the division, the first problem we looked at was the whole financial space in which, and the legislative space in which the THA operates. We have a situation where every country in the region, maybe every country in the world, is running a deficit budget, and Tobago having to compete with Barbados and St. Lucia and Grenada and Jamaica and Trinidad. We are functioning on a fixed allocation and having to essentially beg, some may say, ask permission from the central government to be able to supplement our budget. We have been stopped or stymied from carrying out development finance and bold contractual arrangements. And we've seen clearly in the last 4 years, have been prevented from even receiving international or portion of the international loans through the IADB. These measures have prevented development and any significant development on the island, and therefore we felt that we needed to find a way to correct that. We have looked at what has happened. We remember that the UNC Minister of the Attorney General, I think Anand Ramlogan, took the THA to court when the THA attempted to bail out Milsherv, as errant as that was, but the THA attempted to bail out Milsherv using a bold arrangement, and the government of the day in Trinidad decided that that was an illegal act and took the THA to court. For whatever reason, the UNC administration at the time, 2013, 2014, dropped that case, and when the PNM came into office in 2015, they took it back up, resulting in a judgment that prevents the THA from contracting using bold development financing arrangements, under the thinking that that was classified as a loan, and the THA could in fact not request a loan without central government approval. We are therefore proposing that the central government provide the THA with a non-objection letter. This will allow the THA to in fact contract using bold and development finance, and this will allow us to supplement the budget and pay over an extended period. We think that is critical for us, and we have done this before. We've asked the central government in a previous iteration before, and we intend to formally do that. We believe strongly that the lack of development that you see in Tobago is partially because of that inability to access non-government funds and to bring non-government funds into the Tobago economy. We have also been charged with the responsibility of bringing back, as it were, town and country planning to the THA. As you know, Section 25 of the THA Act stipulates that town and country planning shall be managed and executed by the Tobago House of Assembly. Many years ago, the PNM Tobago House of Assembly gave that responsibility back to the central government. We think that that simple act has led to significant loss of investment in Tobago. We believe the length of time that it takes the Ministry of Planning through the Town and Country Planning Department to approve development plans has been extraordinarily long. We believe the process of appealing to a minister in Port of Spain is time-consuming, and we are in fact appealing to a board of people. In my own case, I remember appealing a decision of Town and Country Planning and having to go to Port of Spain and to talk to people where 90% of them had never come to Tobago at that time, and making decisions for us from Port of Spain. And so, given that especially that we have been asked to follow the laws from the Parliament and from the government in terms of government taking us to court and denying us the opportunity to bring development finance into the country, and we have a situation where the government is also now breaking the said law and not willing to give back, quote unquote, the responsibility for town and country planning. As you may know, the Tobago House of Assembly went to the House and passed a motion to take this back. The Chief Secretary has in fact since 2022 been pursuing this matter with the Minister, then Minister of Planning, Minister Beckles, for up to 3 years now. And we are still at this place where we simply can't get that to be brought back to the Tobago House of Assembly. And so we are proposing that the THA has, in fact, we will have asked leave of the Executive Council next week to set the date of May 1st as the start date for town and country planning in Tobago, and we hope that the ministry, we are confident that the Ministry of Planning and the Minister of Planning will, current ones, will sit and work with us to ensure that happens. We will also ask leave of the Exec Council to allow us to develop our own appeal board in Tobago. We feel strongly that Tobago should decide for itself. Apart from the plans that we have to zone the island differently, to do all the spatial planning required for Tobago, we want to telegraph to the public that when we have finished creating the plans, that we will have a one-stop shop, a one-stop approval window in the THA. Our hope is to second staff from all the statutory bodies that affect or impact the procurement, but impact the approval process. So we'll bring people from WASA, people from Works Division, people from Public Health, and so on, people from Fire Service, into one location. So when you submit your plans, we are going to determine a short time for approval. And for now, we are thinking that we can be able to do that in 2 weeks, but we will discuss with the staff at the Town and Country Planning, and we will come up with a realistic short period of time. The goal, of course, is to ensure that investments are made in Tobago and not blocked and stymied by a long and lengthy approval process. Too many of us have been waiting for too long to get heritage lands owned by your parents subdivided and have to wait for years to get Town and Country to approve it. We want, when we rezone the island, that those lands that are now agricultural lands, what will ever become residential will become residential automatically, and what will become industrial will become industrial automatically, making the process significantly shorter. So look out for an approval authority that will govern this whole process to shorten the time significantly. I've been looking online and seen these questions relating to the motion, especially from Trinidadians, and people questioning why a referendum process and why is it necessary if we want to secede, if we have money to do our own thing and we want to do our own thing and so on. So the reality of the situation is this, that we have been at this dance, this slow, quick, slow dance for too long. And when we make one step forward, we go 2 steps backwards. And we feel strongly, and we hope the public in Tobago, by their vote in the last election, feel strongly with us that Tobagoanians must decide the route that Tobago takes to govern itself. And so our goal through the process we've outlined in the House is to give the Tobagoanian the opportunity to decide on referenda questions that will be developed, be put to the public for approval, and then hopefully will be voted on. That allows us to decide. For example, I don't want to give the example in the House about sports and all that. I see people thinking that we can be like Nevis and produce West Indies cricketers, but the fact is that even going for development funding is an opportunity that we could put to a referendum. And so this allows us to set the foundation. I want people to buy into the idea that you, the Tobagonian, must feel that you must decide where you want to set the foundation for this island, for my children and my grandchildren and your grand and great grandchildren, if we are to move this thing forward. So the referendum process, the two examples above, the planning, lack of approval, the lack of planning from Tobagonians for Tobago spatial planning. You could imagine we're in 2026, we'd have a spatial plan in Tobago. It's all, we've been left abandoned almost, waiting for someone else to come and do this job for us. And this THA is saying that we are going to take that opportunity and be man enough to say we have to do this thing ourselves, and we are going to do it. So I want to thank the listening public. We plan to be short today, and hope that you support the ideas that Tobago must decide for itself, whether it's through planning, whether it's through town and country planning, and whether it's through the legislative agenda that we will put out. Thank you very much.
Thank you, Secretary James. And now we'll accept questions from members of the media. So before we accept questions, actually, Dr. Brebner, Assembly Member Dr. Brebner, will deliver some closing remarks.
Certainly, thank you, Davia. So I won't say closing remarks. I thought it important, since I am already sitting here and since the Chief Secretary has indicated to the public that a description or a discussion of the new configuration of the Tobago House of Assembly is one that we will also have at these post-executive council briefings. I thought, I'm already sitting here, I may as well speak about what is happening at the Division of Health and Wellness. As the population is aware, we now have many more divisions than we had before. What used to be the Division of Health, Wellness and Social Protection has now broken up, where the Division of Health and Wellness is an entity and Community Development and Social Protection is another division within the Tobago House of Assembly. I have retained responsibility for the health-related arm of the Tobago House of Assembly, and that new division will include some of the things that we currently do, but I wanted to chat a little bit about some of the areas that are going to be relatively new to the Tobago space. My colleague, Secretary James, both of my colleagues gave me an impetus to push for, outlining the things that are new in this dispensation of the THA. So as you are fully aware, the Office of the County Medical Officer of Health will continue functioning, and that office has these statutory requirements that are national and international requirements as it relates to community health, public health, port, transportation and so forth as it relates to the safety surrounding those. Our Public Health Services Department will continue to function and will provide, in essence, support to the Office of the County Medical Officer of Health, and the public health entity will continue doing what it does, including food safety, water safety, environmental safety as it relates to garbage collection and that type of thing. They, as you indicated, the Secretary James, and we'll be very, very happy to be a part of that process where we sit together and ensure that these plans are approved more speedily, because the public health component is important in that regard. We will also continue having, but we'll have a beefed up monitoring and evaluation and strategic performance unit that will really pay very close attention to what we say we are doing and what we said we would do, whether we are doing what we said we would do, and whether there is a benefit to what we've said we will do. And that, Secretary James, the information from that monitoring and evaluation and strategic performance unit will also feed very heavily into what happens at planning and so forth as we go along. Of course, we will continue to have the corporate and administrative areas, the accounts and the HR and so forth. But the new areas, which are the ones I want to chat about quickly, we will have a wellness prevention and health promotion department. Now, that I am particularly excited about because if you remember, the Division of Health and Wellness is responsible for the policy the policy arrangements or the policy that relates to health on the island. We then, in essence, contract the Tobago Regional Health Authority, the TRHA, to provide the medical services. So the TRHA will provide the medical services. What we have not been able to do on the island is really focus on the preventative and the wellness component of it. And this Wellness Prevention and Health Promotion department will really spend a lot of time looking at where we are, identifying what are the things that cause us to not be healthy. You know, last year, I spent quite a bit of time when we were talking about the fact that the hospital had to go in emergency mode and so forth, talking about the fact that one of the reasons that was the case was because we really have quite a number of people who are presenting to the hospital sicker, and they are presenting to the hospital sicker for things that are non-communicable diseases, for things that are quote-unquote lifestyle diseases, the diabetes and the heart disease and so forth. And these are the areas where if we spend a little bit more time and effort, we can actually do quite a bit of prevention. So that unit will be tasked with really doing some deep dives into why what we've done thus far has not necessarily worked as well as we thought it should have worked, and to implement projects and programs throughout the island that really focus on helping us to get well and helping us to get better and helping us to be healthier. And therefore, ideally, within a couple of years, if that unit works, we will probably have less people going to the hospital, less people going to the health centers, because they are generally well. Another unit that we are hoping to implement is one that I've spoken about even in the early stages of being Secretary with responsibility for health, and that is a unit that provides, in essence, stricter oversight over what happens at the Tobago Regional Health Authority. As I said before, what should happen is the Division of Health and Wellness should really identify the services that we need done. We should then create what is known as an annual services agreement, which is really a legal contract with the Regional Health Authority, and where we say to the Regional Health Authority, this is what we want you to do. These are the clinics we want you to host. These are the services we want you to provide, the clinical services that we want you to provide, and we will pay you 40, 50, whatever $1 million a month to do that. So part of this unit will be to work through that actual legal component. Secretary Joseph Wallace, we will definitely be working closely with you as well to help us work through that arm of it. But the other part of oversight really includes ensuring that we have an external eye, ensuring that we have our patient safety procedures happening as they need to be, having independent, quote-unquote, people go into the hospitals, for example, or health centers when there may be adverse events happening, and ensuring that we can do that kind of deep dive to ensure that what happens at our health facilities is the best for all of us. The third new entity that we will include at the Division of Health and Wellness is what is known as a Tobago Public Health Observatory. And that, in essence, would be a hub where all health affecting data will come together for analysis so that we really figure out what is happening on the island. That includes data from the Tobago Regional Health Authority. It includes data from our social protective components, and it may even include data from, for example, the TTPS when we are looking at road fatalities and whether there are incidents of drunk driving and that kind of stuff, so that when we create policies as it relates to the health services of the island, it will also include data from public health. So we know, for example, if there are clusters of mosquitoes anywhere and that kind of stuff, so that when we create policies, it really is based on us looking at comprehensively, looking at the data, looking at all of the things that can influence our health outcomes, and creating policies and therefore projects and programs based on that data. So I am truly excited about finally implementing that health Public Health Observatory. We will continue, of course, executing some of our grants, the grants that are related to medical support, outhouse eradication and water tanks and those things. And finally, at the division, we will reintroduce, because I think we had it before, something that is a little bit more expansive than EAP, really Employee Assistance and Workforce Wellness Unit, where we will provide to our entire, to the staff, the internal staff at the division, the kind of support that they need for them to produce, for them to work, for them to be the best that they can be. And that may include counseling, it may include substance use or misuse guidance, and it may include preventative areas. You know, I keep telling my administrator that I am sure one of the first things that would pop up there is us purchasing probably some massage tables, so that we will have massages happening at the division as part of our wellness and prevention of our internal staff. And you know, my colleagues are welcome to join the division for that component as well. But that is the kind of thing that this unit will work on, and it would really be to ensure that the staff that provide services to the public, they are well taken care of. So, Davia, I just wanted to take a little bit of time to indicate that while there are brand new divisions and departments and units happening that are being built out, even those that are not new are being reworked to ensure that we provide the best kind of service to the people of Tobago.
Thank you, Assembly Member Dr. Brebner, Secretary of Health and Wellness, as well as Deputy Chief Secretary. So now we will accept questions from members of the media. Please note, we'll only accept 2 questions per media house in the first instance. 2 questions per media house in the first instance. Elizabeth Williams, TV6 News. Good afternoon, Elizabeth.
Good afternoon, Davia, and of course, your panel. This question is for the Deputy Chief Secretary and the Health Secretary, Dr. Faith Brebner. There is a situation with respect to health where a number of nurses who were promised permanent contracts, we have received information that they are now getting 3-year contracts instead. Could we get a comment from you on that matter? Because some of them are very disappointed when they are called to HR. They are being told of 3-year contracts instead of permanency. And of course, in terms of congratulations on the Tobago Public Health Observatory. With respect to that, could you give us like a percentage in terms of people in Tobago and the various diseases that the island is combating at this time?
I didn't get the last part of the question. Could you repeat the last part of the question?
Sure, Dr. Faith. With respect to the Tobago Public Health Observatory, and I know you spoke with respect to health conditions on island, I just wanted to know from you if you have like a percentage in terms of the various diseases in Tobago, in terms of what we are combating.
Certainly. So I will go with your last question first. The reality is that we really do not have that data. We don't have that data because we are not strategically collecting the data in a way that is analyzed and can allow me to report to you in any meaningful way, which really is the reason why we are going to have the Tobago Public Health Observatory. What you recognize is we have medical data in medical records, but that data is not necessarily translated into a database that would then allow us to see at the drop of a hat how many diabetics we have, how many people with heart disease, how many cancer patients, and so forth. And it is that kind of analysis, that kind of data collection in a way that is easy, that is really the function of the Tobago Public Health Observatory. So ideally, in a couple months, in a year from now, we would be able to provide that kind of information at the drop of a hat. As a matter of fact, part of the responsibility of the observatory would be to provide that kind of at least yearly status of the status of the health of the population reports. As it relates to the nurses, in December, we started the process of providing permanent employment to staff at the Tobago Regional Health Authority. When I became secretary with responsibility for then health, wellness, and social protection in December 2021, one of the first meetings I had was with the the Nursing Association, and they highlighted the fact that there was a time in the Tobago space where nurses and other health professionals were permanent, and for some reason that was changed to them being contract staff. At that point, and subsequently, we have been working with the Tobago Regional Health Authority to reverse that decision. That is a continual process. There are nurses who have been given letters indicating that the process has started, and even some of those nurses who you've spoken to, Liz, have contacted me, and I've said to them, this is a continual process. So until you've actually gotten to the part where you are permanent, we need to keep covering you. So again, it started with some of the nurses. It's being rolled out continually, so it's just a matter of time. I am sure even those nurses who were told that they were on the list had hundreds of people. The HR unit at the TRHA is going through that list sequentially, and we will get to you soon. However, we don't want a situation where you are without contract and you are not yet permanent. So we are allowing you to take up the contract for that period as we continue the process of giving permanency to the nurses. And by the way, it will not just be nurses, it will be rolled out to other categories of staff at the TRHA as that process goes along.
Stefan Nicholas, Guardian Media Limited. Good afternoon, Stefan.
Hi, good afternoon.
Good afternoon.
I have a couple of questions for Deputy Chief Secretary Faith Brebner. We just came out of the cargo boat disruption, and now we have an SOE announced on Monday. You opened today saying Tobago is open for business, but are you concerned the SOE could hamper arrivals on the island, particularly through this winter season? And also, earlier today, the TTFA announced the tenure of head coach Dwight York ending. Not only is he a Tobago icon, but a national icon known worldwide. There are also reports that he's owed 5 months' salary. How do you feel about the tenure of a national icon coming to an end at Tobago now?
So let me... So the reason I started the press conference by indicating that Tobago was open for business was to say to the general public, as in Trinidad and Tobago nationals or regional public, that we really truly are open for business, and therefore, unless there are specific disruptions to our transportation mechanisms, then we are open for business. So unless for some reason there is a further disruption of the sea bridge, or whether if our airspaces are closed, those things have not happened. We knock on wood that those things will not happen, and therefore we continue to function, we continue to behave, and we continue to act as if we are going about our business normally. So I am not concerned about that. This chief secretary, over the last 2 press briefings that he did, outlined the fact that we have been working very closely with our counterparts in Trinidad to help resolve the forever and a day inter-island transportation issues that have been decades old, and we seem to be getting to a place where they are less of an issue. We will continue working with the counterparts in the government of Trinidad and Tobago to ensure that those challenges are resolved for once and for all. So I'm not too concerned about that. I had not heard about the issue with Dwight York. Of course, he is someone who is a beloved Tobagonian. We are very, very proud of all that he has done. As a matter of fact, he's one of those individuals who have put this island on the map because his name is synonymous with the island, and wherever he goes, you know, he represented the island very well. I have no information about him not being paid. I will not comment about that because I really truly don't have any information about that. I will not comment about that. Maybe I was about to say I will probably ask Secretary James to comment, but I will not ask Secretary James to comment on that either. But you know, we are proud of him, and we continue to be proud of our Tobago icons.
Thank you for your questions, journalists, and thank you for your responses, Dr. Brebner. Viewers, on that note, that's how we ended this week's Post-Executive Council media briefing. Let me take this time to thank our presenters, our Deputy Chief Secretary and the Secretary of the Division of Health and Wellness, Assembly Member Dr. Faith Brebner, Councillor Adana Joseph Wallace, Secretary of the Division of Legal Affairs, and Assembly Member Trevor James, Secretary of the Division of Strategic Planning and Development. I'm Davia Chambers saying thanks again for joining us. We hope to see you again next week, Thursday, for another Post-Executive Council media briefing. Have a wonderful afternoon and weekend.